Welcome back, Dr. Lindner here. Let's take a look at some of the other facial bones and the bones inside the ear and the auditory ossicles, as well as the hyoid bone. Okay, so let's take a look here and let's just review some of the things that we already know. We know here is the frontal bone. Down here at the bottom, this is the mandible. Up here is the maxilla, that's the upper jaw. So the maxilla has an attachment for the teeth to go in the gums, and that's called the alveolar process. Okay. What else do we see here? Here is your vomer. Here's your perpendicular plate. There's your inferior concha, middle concha. Superior one we don't see. Here's the glabella. Here's your nasal bone. Here's the supraorbital ridge. Supraorbital ridge. And on the bottom, they call this the orbital rim. Orbital rim. So here's the orbital rim. Here's the supraorbital ridge. Here's the alveolar process, which is part of the maxilla, which is the upper jaw. Here's your anterior nasal spine. Anterior nasal spine. When we look at the maxilla, which is the upper jaw, from the inferior perspective, we're looking at the upper jaw. This portion here is the palatine portion. It forms the anterior 3/4 of the hard palate. Okay, this is the palatine process. Again, palatine process here and here. Here is the maxillary sinus. We did the ethmoid sinus. And then here are the turbinates, right? That's going to centrifuge and spin the air as it is inhaled. Here's the palatine bone. That's this portion in yellow. Okay, so if we go back, the palatine process is the anterior 3/4, and then the posterior quarter right here is the palatine bones. Now, what's really cool about this is from the underneath, look here, we can see this and this. This is the medial pterygoid process. Here's the lateral pterygoid process. That's where the internal pterygoid muscle and external pterygoid muscle, which are involved in chewing, also known as mastication, will attach. Here's the palatine bones. Again, it's the posterior 1/4 of the hard palate. Here's the nasal bones. That's in purple right here. That's the nasal bone, which is just inferior to the glabella. The glabella is inferior to the frontal bone. Again, from the lateral view, there's the nasal bone. Close-up view from the anterior, nasal bone. Here's the vomer. We've covered that. What is the structure that's superior to it here? That's the perpendicular plate. And then the perpendicular plate is going to peek through the top right there, called a crista galli. Here's your vomer. Here's the perpendicular plate. Here's your inferior turbinator concha and the middle turbinator concha. Here's the inferior nasal concha. Repetition, right? It's beautiful. Repetition's a good thing. Here's your inferior nasal concha. Here's the zygomatic bone, right? So this structure here, we typically refer to it as the zygomatic arch, but the zygomatic arch has a few different parts to it. So this in blue right here, this portion here, is the temporal process of the zygomatic bone. Here, is the zygomatic process of the temporal bone. So it gets a little tricky. So there's a temporal process of the zygomatic bone, and then there's a zygomatic process of the temporal bone, which is here. Okay, so if we look, here's the temporal process right in the beginning, right there. Temporal process of the zygomatic bone. And if we were to go here, this is the zygomatic process of the temporal bone. Okay, don't confuse the two. All right, here's the nasal bone, and just lateral to it, right? This is more medial. As we go lateral, it's the lacrimal bone, not to be confused with the lacrimal fossa, which is up here. So the lacrimal bone is here. We'll put L for lacrimal. Again, here's the nasal bone. Here's the lacrimal bone. Lacrimal, ethmoid, sphenoid. LES, L-E-S, lacrimal, ethmoid, sphenoid. Okay, when we look at the mandible, let's look at some of the main landmarks here. So this is the lower jaw, right? So we're looking at everything that here. And there are some major landmarks to know. This is the angle. That's the angle of the mandible. This right here is the ramus. The ramus is needed because it kind of, without it, you can't form the angle. Here's a mandibular notch. You have a coronoid process, not to be confused with a coracoid process, because we haven't done coracoid yet, but there is a coracoid process of the scapula. Okay, don't confuse the two. Here is the mandibular process. This they call the head, but it's the mandibular process. The mandibular process, mandibular notch, coronoid process. It is the mandibular process that's going to articulate with the mandibular fossa to create the temporal mandibular.
Did he freeze for y'all?
Yeah.
Yeah.
Yeah, it's frozen.
He's froze. He'll be probably back.
Everyone's back, which is great. Let's make sure we're back in recording. Okay, so we're looking at the inside again of the mandible. We have the alveolar processes. This is where the teeth are going to plant themselves inside the bone. Here's another foramen on the inside, and that's called the mandibular foramen, not to be confused with mental foramen. Mental foramen is in the front and the anterior. The mandibular foramen is on the inside. Here is the coronoid process, and here's the mandibular process. Here's the mandibular notch. Here's the angle. of the mandible, and then here's the ramus of the mandible. Okay, let's take a look at the auditory ossicles inside the ear and the hyoid bone. So there was a picture when we were looking inside the cranial vault, and I said the petrous portion of the temporal bone is really important. Let's see if we can go back and find that real quick for you. Right here. So this structure here is that petrous portion of the temporal bone, and deep within it is going to be this structure that we're covering right now. So deep to the petrous portion, remember I said it looks like a snail shell? Well, the snail shell is called a cochlear. Okay, the part that deals with balance is the vestibular portion. And the vestibular canals are called semicircular canals. They're here. Those little tubes that we see hiding out inside. So all of that is deep to the petrous portion. This cochlear deals with hearing, and in here, we're dealing with the vestibular portion deals with balance. Okay, when you deal with hearing, you have the auricle of the ear, and this is like the outer part of a funnel is going to collect the sound waves. It's going to go in the external acoustic meatus, that's the hole here, and sound waves come in through the external acoustic meatus, and they hit the eardrum known as the tympanic membrane. When the tympanic membrane vibrates or shakes, it's going to send the vibration into the auditory ossicles, which are three bones: the malleus, the incus, and the stapes. That vibration through the tympanic membrane is going to oscillate into the ossicles, and it's going to send a vibration into the cochlear, where you have fluid moving around the sensory organ of the ear, and it's going to relay that to the vestibular cochlear nerve. The cochlear portion deals with hearing, the vestibular portion deals with balance. And that's what cranial nerve 8 is, the vestibular cochlear nerve, cochlear for hearing and vestibular for balance. Here is the hyoid bone. It's the only bone in the body that does not articulate or attach to any other bone to form a joint. This is the body of the hyoid, and then there's a lesser horn and a greater horn of the hyoid. There are lots of muscles that attach to the hyoid bone. When we get to muscles, you're going to hear of like muscles called the geniohyoid, the omohyoid, the thyrohyoid. So when you hear the word hyoid, you have some reference as to where those muscles are going to go. Okay, when we come back, we're going to look at some of the foramen of the skull, the holes of the skull.